We're going to start using these beds while we're doing additional construction at our facility over the course of the next few months. And so we're going to start using this actually as early as next week in order to have patients over here. We're going to be temporarily using it for emergency department patients while we finish the rest of the renovations. And then once everything is completed, we'll be able to use this for medical observation as well. The behavioral health beds, however, are ready to go next week. If somebody has COPD or other kind of respiratory issues with asthma that need a little bit more time and medication treatment with monitoring in the hospital, that is one usage. Other people that have other complaints such as congestive heart failure that is mild, that maybe needs to get a little bit of fluid off of them, and a myriad number of other ones that are very specific for taking care of them, that it isn't going to require multiple days in the hospital. It's really about patients that just need a little bit more time with us so that we can make sure that they're ready for discharge.
That's something
fine.
that you could talk on?
Well, these particular rooms, we have set them up so that they're as convenient as possible for both the nurse and the patient. So we can take care of patients in these rooms. At present, with hard lines that will transmit their ECG tracing not only to the nurse's station, but to the unit that's up on the wall, so we can keep track of all of our patients, as well as back into the ED proper. So it gives us a lot of advantage of keeping track of our patients. And for ease of use, we actually designed these rooms so that there's a provider side to the room and a patient family side when we can do visitors again, so that we're not making our families uncomfortable. We've also put some TVs in here. If anybody's been in the ER, you know that it feels like you're sitting there forever. So the TVs provide some distraction for our patients. The particular equipment that we put in these rooms is so that it can be removed, should we need to remove it for a patient that maybe is infectious and we want to move all this stuff out, or we just need additional room. So there's a lot of thought that went into this so that the equipment, the places, and the people are where are the most efficient.
That's all part of the existing emergency department right now, which we've outgrown, and now it's time for us to renovate that as well. So then we'll be opening up the former ED into expanded new space and increasing that significantly over what was there. Well, you know, certainly any construction project is a challenge, particularly in a hospital facility where you're using it 365 days, 24/7. And certainly it would not have been our desire to be doing an emergency room renovation and expansion in the middle of a global pandemic. Our staff really deserve a tremendous amount of credit in the emergency department for dealing with the challenges of construction and renovation and significantly increased demand for emergency department services throughout this period of time, and dealing with people who are extremely sick as a result. We know that many people have delayed care. That's been a concern. We understand that. So then the people that end up coming to the emergency room tend to be much sicker than people previous to the COVID crisis. You know, I think we have a unique approach here. We have rooms that are dedicated to the needs of people with psychiatric and behavioral health emergencies so that we can care for them safely and comfortably. And in our way of doing things, those rooms have dual capability so that they can be used for medical emergencies as well. So we think it's a very efficient design. We think we're breaking ground in that regard. I think we'll see more of that across the country, but we're very pleased with how that's come out, and we expect that that's going to be a much better experience for our patients as well as our staff.